Let me first of all thank Children Home and Aid Society for allowing us to meet here this morning and for our community partners. Since I've been here, I've learned that this state is blessed with an experienced and passionate and committed child welfare staff, both within the Department of Children and Family Services and within our community partners. Yet because of a revolving door of directors over several years, Illinois is faced with questions about the department's ability to provide necessary oversight of the system and a vision for the future. We know so much more today than we did 10 years ago about brain development, about the impacts of trauma, and the impacts of adverse childhood experiences on the well-being of children and youth. And we will know more 10 years from now than we know today. As a result, we need to use the new knowledge to inform the way our supports for children and families move forward. Today is an opportunity to share with you additional information about the Department of Children and Family Services transformation and strategic planning process. As you all know, and I'm not telling you anything new, Illinois has been under a federal consent decree for the period of the last 26 years. But I want to make it clear, I did not come here to resolve a lawsuit. I came to Illinois to return this state to the top tier of states in terms of how we use science and knowledge to inform our practice. So today's remarks will be more than just about the BH consent decree. As of last week, I've now been director of the department for exactly 1 year. During that time, we've seen some change, but there's also been a lot of planning going on within the agency and on the part of groups like CWAC. Now, I will be the first to admit that change is always difficult, but as our knowledge grows, as our science informs us, change is inevitable. So we must embrace that new science and the change that it will bring. We need to fundamentally build on the successes of the past, admit the mistakes that have been made, and merge past successes and lessons learned into a vision for the future. So we are now getting to the action phase. I want to thank CWAC for supporting today's event, and all of you for taking the time to be with us. I look forward to working with the membership of CWAC in a collaborative way, as well as with the organizations who are our partners around the state. There will be much more detail after this presentation that will be forthcoming. But we have learned a lot in the last year. DCFS began this critical planning process with the KC Family Program's rapid response effort. And by agreeing with the plaintiffs in the BH consent decree on a team of national experts to inform our work. Out of that came the BH implementation plan, which was jointly filed yesterday in the Federal District Court of Appeals. We have started to be much more inclusive, and we have to continue that. And I think that we've demonstrated that over the period of the last year by visiting with many of you in your individual communities, with our partners in the field, with our DCF staff, and with having just this past week the 2 new CWAC co-chairs at the initial DCFS strategic planning retreat. I recognize that the work we do will only be successful if we engage all of those who touch the lives of children and families, the department and provider staff, the judicial and law enforcement community, our guardians, our birth and foster families, our advocates, and yes, young people themselves. We must remember that we designed a whole child welfare system in this country and never talked with kids. And who knows more about its strengths and weaknesses than children themselves? From this point forward, we will be guided by the input provided by our youth. Over the last year, we have brought in independent consultants to assess DCFS and make recommendations. The Casey Family Programs Rapid Response Team was formed, and a great deal of time went into formulating priorities for the department and moving to resolve outstanding issues. We have drafted and submitted an implementation plan in response to the BH expert panel. We have also started to do broad work with the governor's office and with our partners in Illinois departments across the human service arena. Today, all of those efforts are coming together in the framework of a statewide health and human services transformation, as discussed in Governor Rauner's recent State of the State address. Shortly after my arrival, I began meeting with many of my colleagues at the Department of Human Services, the Department of Public Health, and the Department of Health and Family Services, informally in such a way as to discuss our crossover opportunities between agencies. For I'm not telling you anything you don't already know, but the better job we do in mental health and substance abuse and economic stress, the better job that we do in maximizing federal money, whether it's 4E or Medicaid, the better our outcomes for children and families will be. As Governor Rauner shared, this transformation agenda for health and human services is laid out in 5 major initiatives. 1, prevention and population health, stopping things before they ever start. 2, moving in a systematic way from institutional to community care. 3, doing a better job of data integration and predictive analytics. 4, really enforcing people's education and their self-sufficiency. And finally, as we proceed, paying for value, quality, and outcomes, as opposed to just paying for widgets. This provides the framework moving forward. The DCF strategic planning began with a retreat last week, where the Casey Family Programs generously supported and facilitated a 1.5-day retreat for DCF leadership and CWAC co-chairs to discuss an updated vision, value, and strategic plan moving forward. I'd like to particularly thank Zach, Buchan, and Trish with the Children, Youth, and Family Solutions for their participation. I think it was productive, and I look forward to additional efforts in the future involving more of you. Our draft strategic plan will be completed by mid-March as a skeleton working document that aligns key priorities and initiatives within the department with the broader HHS transformation and an overarching mission, vision, and value statement that drives our work. Upon completion of this mid-March draft, the DCF Strategic Planning Unit, led by Jody Grutza, will be scheduling time to meet with internal and external stakeholders, such as yourself, across the state. We will also include birth and foster parents, foster youth and alumni, foster parents, guardians, judges, and law enforcement. It is my intention to, following that process, holding 4 town hall meetings around the state to receive additional public input. All of that input will be integrated in the final plan published in July of 2016. But to highlight our flexibility moving forward, we are looking at moving decisions to the front line who know our children and families the best, to empower our providers but holding them to a high standard and expecting outcomes, but also keeping children and families at the center of everything we do. Prior to my arrival in Illinois, Interim Director Cynthia Tate requested that the Casey support improved an effort to improve our current procedures and practices. Within weeks, Casey Family Programs assembled a diverse team of child welfare experts who facilitated a 28-week process focused on evaluating and improving the system. They focused on 3 areas: residential care, safety and supervision, and data. Much of the reform work already going on within DCF is a result of that rapid response process. And it includes residential procedures updates, data improvement, and residential care improvements. This effort has laid the foundation for the strategic plan and for the BH consent decree implementation plan. I am pleased to say today that yesterday, February 23rd, the date that will live in infamy, the department filed a joint implementation plan in conjunction with the B8 expert panel and with the plaintiffs. And I want to particularly thank the experts who worked tirelessly over the period of the last several months with us. And I want to pay a particular note to the plaintiffs. Too many times we see this as an adversarial process, but this wound up being collaborative. And I think the outcome proves that, because all of us, whether it's the media, the plaintiffs in this case, the experts, our providers, those folks throughout the state, all of us want the same thing, and that's good outcomes for children and families in Illinois. I think this represents a huge milestone in the BH lawsuit and a potential for progress as we move to better serve children and families. The BH plan includes numerous examples of operationalizing a broader transformation across the human service agencies, and can lead us to a more systemic and necessary reforms that we have to do. One of the core statements made by the BH experts is that the department and Illinois needs to pilot solutions rather than rolling out major changes system-wide. We need to learn from those pilots, evaluate those pilots, and make long-term decisions as to how we should proceed from here. So our entire plan moving forward is focused on pilots, evaluations, better assessments, and expansion through implementation. We will be reporting every 4 months on overarching outcomes to the expert panel and to the federal court as defined by the Federal Child and Family Services Review outcomes on safety, on permanency, and on well-being. And I'm pleased to say that these outcomes will soon be available in real time due to contract support that we've reached out to for predictive analytics that will provide a dashboard on not only CFSR outcomes, but on additional metrics in the weeks to come. And I'm asking now the CWAC Wellbeing Committee to work with our contracted national expert, Mark Courtney, a nationally respected researcher and statistician, to further define the suggested well-being outcomes and also develop processes for tracking these measures. Moving forward, our plan incorporates several initiatives. Number one, system of care demonstration pilots. We recently advertised an RFP for 3 therapeutic foster care pilots and received 26 responses. The procurement process has evaluated those responses, given those to me, and within the next couple of weeks, we'll be announcing the results. These 3 pilots will create a home setting to serve children with higher levels of need and create an alternative for residential placements. In addition to that, the care management entity pilot currently serving Champaign, Ford, Iroquois, Vermilion counties is one we will recommend proceeding with and also expanding to other areas. Also, our dually involved pilots, the current Pay for Success project with the Georgetown Crossover Youth Model and the Regenerations pilot, are serving a population that has been challenging in the past, youth in both child welfare and juvenile justice. These pilots will continue and will be evaluated by Chapin Hall to determine which model makes the best sense to proceed with. 2, a core practice model in immersion sites. The department is taking the current family-centered, trauma-informed, strength-based model now used in our child welfare employee licensing training and utilize it to embed our core practice model in everyday practice across the state. Now, we will continue to work with our private providers on the initiatives that they have already undertaken to implement core practice models in their individual systems. A model of supervision will also be implemented to teach supervisors how to manage, how to coach, how to evaluate frontline workers. These models are not intended to be redundant to those provider agencies that have already actively utilized such models. We will work through with the private sector how to implement this in a cohesive manner. Immersion sites, a term that may be new to many of you. But the department will begin a multi-year process of immersion sites in August of 2016. Immersion sites are pilot sites representing a small geographic area of Illinois. DCF leaders and staff, private agency staff, guardians ad litem, court-appointed special advocates, youth, birth parents, foster parents, court officers, care coordinators, and residential and group home agency staff and other community resources will be involved with children and youth in foster care and will come together to develop a pilot site that is family and child centered. These sites will be a true partnership between the department and our community partners, working together with kids and families through shared ownership. The first cohort will include 5 to 10% of children in care across the state in 4 geographic areas, 1 in each region. Rollout will continue over the period of the next 3 years. The key to this is strong regional involvement and regional oversight. So it is my intention to push to the regional level significant decision-making authority so that it can be done in a coherent and comprehensive way that takes into consideration the needs and the values of individual communities, so that we can ensure that local barriers are identified and resolved quickly. It means empowering those individuals who are closest to the children and families that we serve. Immersion sites will also access support of our strategic planning and innovation unit, our training unit, and of our quality assurance unit. Current processes such as clinical interventions, integrated assessments, monitoring, central matching, quality assurance will all be evaluated in each individual site, and shifts in current practices can occur based on local needs and local recommendations. The same will occur with all DCF policies and procedures, creating the flexibility needed to best serve individual children and families. I believe this is a new and exciting, but I also recognize it's downright scary. I understand that although this framework has been developed, it is really up to the local sites to develop the systems that work best for them. It means trusting people and empowering them. Immersion sites have been successfully implemented in other states, principally Alabama and others, who are also facing federal consent decrees, and they have truly moved their systems forward. In addition, in July of this year, 2016, we will hold a statewide summit in conjunction with the Illinois Office of the Courts with federal court improvement dollars. And that summit will be used to kick off, provide the relevant training opportunities, provide the kind of time necessary for local planning, and share our strategic plan. The courts, our private agencies, and many others will be part of the planning for this summit. And participation will be as inclusive as possible. And we're looking for a summit involving somewhere in the neighborhood of 750 individuals representing all of those across the state. When we did this in another state that I'm from, we ultimately got to the point where we had 2,500, where there was a real cohesiveness within the dependency system in that state. We also know that youth over the age of 12 require many additional services and additional assistance to achieve permanency, so they do not age out of a system without substantial relationships, without the necessary health skills, without the necessary education, without the necessary community-based supports to allow them to achieve. Because ultimately, those children who age out, the success of what we do depends on their outcomes after the age of 21, not while they're in our care. So this department will focus on this population through statutory policy and practice initiatives. And I'm pleased to say that the governor's new recommended budget fully funds services to that population.
Great.
Nice.
In addition, DCFS is expanding age eligibility for state-funded guardianship, regardless of 4E eligibility. And the department is expanding the definition of, quote, fictive kin to include current foster parents. Both of these efforts may result in actual cost savings through a fully funded kinship guardianship program. We're also fully implementing Procedures 315 to expand and improve family finding strategies. Fourth initiative under the plan, we've streamlined the department's organizational structure in order to better align decision-making. Silos within our agency are no more acceptable than silos between us and other agencies. We've created the Strategic Planning and Innovation Unit. That unit will not be to operationalize individual pilots or initiatives. But that unit will drive and track implementation and lead the systemic cultural change within DCFS and with our partners. In the area of technology and predictive analytics, you know as well as I do that this state is in the dark ages when it comes to the use of technology. There was a time when we had more questions than we had data. Now we had so much data we don't know what to do with it and how to analyze it. So we will be releasing an RFP in the next 12 months to replace the current SACWA system and do that as part of the overall strategy. You're welcome to applaud. Without being biased, the SACWA system is built on a legacy system. It is archaic. It is not functional for our frontline staff. In the interim, because that is a 3-year process, in the interim, there will be limited enhancements made to the current system. Our technology office will begin providing real-time data through a dashboard with an external contractor while internal capacity is built. One of those current successes in this area, I think, includes the mobility pilot that we're doing in Mount Vernon and to some extent here in Cook County. It also includes the 360 view so that we can integrate TANF data, Medicaid data, SNAP data, and do that in such a way that when you enter in the child's name, it automatically pre-populates with known relatives and gives you that kind of factual information. That will be rolled out this summer, and that will be followed by an integration of sexual offender data, of child support data, and other data moving forward. The more we know about the family, the more we can do that in advance for the caseworker, the more we can allow the caseworker to do casework rather than paperwork, and rather than a diligent search. We're also kicking off internally, and we'll be expanding later to our private providers, what we're calling a Success Academy. This academy will be conducted by the Casey Family Programs and will provide a 6-month long 10-session training for our mid-level managers. Because ultimately, the leadership by itself can't make this happen. We've got to engage and empower our staff. So the academy will start with the leadership of the department nominating individual leaders within the agencies who will complete an application process, and additional cohorts will continue over the period of the next couple of years, both with DCF as well as our provider agencies across the state. Finally, we are committed to enhancing the way that the department does monitoring. In the area of well-being monitoring, the department is negotiating a reinstitution of the Illinois Survey of Child and Adolescent Well-Being. And in the area of residential monitoring, the department is partnering now with 2 university partners, University of Illinois at Chicago, Northwestern University, as well as Chapin Hall at the University of Chicago, to develop a comprehensive residential monitoring system by May of 2016 to complement the internal monitoring that is going on. In closing, I want to thank all of you here today and those joining us on the phone and via video for all of the work that you do to improve the lives of children and families. Most of you have been at this work for a long time, and you have seen change come and go. But if we really work together, if we really utilize the new science that has really emerged only in the last 5 or 10 years, we can make a significant change for the children and families of Illinois. It took Illinois some time to get to where it is. And I think some of you look back at 15 years ago when Illinois was seen as a model country. We need to return to those days by building on the successes of those days, admitting the mistakes and not being defensive about it within the system, and do that with a lot of effort, with a lot of patience, and a lot of collaboration to turn the ship around. Because I know that none of us can do it alone. I would harken back, you remember the old movie Apollo 13?
It's not that old.
I'm like, really?
Thanks, Teddy.
I totally agree. Right? I thought he was doing
Teddy is so young. But if you remember in that, NASA feverishly tried to save the astronauts, Jim Lovell, Jack Swigert, Fred Hayes. And in that film, if you recall, the director of NASA said, under his breath, this is going to be NASA's worst disaster. In response, Mission Control Director Gene Kranz responded, with all due respect, sir, I think this will be our finest hour. We are under the gun and bringing this ship in for a safe landing after the Chicago Tribune harsh treatment series, after a lot of the heat that has been put on this agency by the media and put on our private sector, after all of that attention from legislators and the community, I really believe this can be our finest hour, but it can only be our finest hour if we work together. I thank you for being part of where we are today and how we move forward. And I know that truly we can make a difference for children and families in Illinois. Thank you, and let's get to work.